Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today I am excited to be joined by Benny Barak. Benny started his career as a corporate lawyer in the largest law firm in Israel and has an MBA from Tel Aviv University and the Hong Kong University of Science and Technology. He has done fintech consulting for Accenture, as well as multifamily real estate acquisitions. And currently, Benny, whose father was an oral and maxillofacial surgeon, is the CEO of Magdent, a completely new technology in dental implants. Welcome to the podcast, Benny.
Hey, Matthew. Thanks for having me. Hello, everyone.
Yeah.
Really excited to be here.
Good. Well, thank you. It's been good to meet you already, and excited to learn more myself about this great work that you're doing. And I mean, you've done a lot of things, so that was the abbreviated bio, right? So you've done a lot of things, but I would love to just kind of, for the sake of going into where your focus is now, to kind of dive straight into Magdent. So can you spend just a little bit of time telling us a bit about the technology that's involved and maybe its benefits compared to other options that are available?
Definitely. So Magdent was founded originally in 2011 in Israel. And we started through a specific case study that, as you said, Professor Shlomo Barak, my father, an oral and maxillofacial surgeon that was also the founder of the largest DSO in Israel 35 years ago, called Maccabi Dent. And so he's done hundreds and thousands of implants in his career. And he had a patient that suffered from cancer. And she came to his clinic, and after 6 failed implants, she came to his clinic, and she had, unfortunately, cancer. That's the reason for the failures.
I see.
And Professor Barak was reading about pulse electromagnetic field called PEMF, which is a proven technology that the FDA approved in 1979 in orthopedic. And he was thinking, well, let's give that lady a chance by sending her to the orthopedic clinic using this technology outside of her jaw, and let's see what the results are. So he asked her to go for 6 consecutive weeks, 3 times a week, for a treatment, potential treatment. And after 6 weeks, she came back to his clinic, and doing an X-ray, he saw that with this technology, the implant was actually successfully integrated. So that's the point where he decided, let's try to incorporate this technology into dentistry. So this is when we started. We received a few grants from the Israel Innovation Authority and the and another incubator in the north of Israel, and we have taken this huge device from orthopedic and miniaturized it into a healing abutment. So this is the device. The device is fully commercialized. And inside the device, we have 3 main components. Wait a second, I'll show you. We have a PCB, we have a coil and a battery inside the abutment. And what we have done is that dentists don't have to change anything in their protocol to use our device. So they have the implant placed. Now it's time to place the healing abutment. And now it's time to use Magdent technology. So we sell miniaturized electromagnetic field devices. That's the device. It comes inside tubes, and each clinic needs an activator. And in order to activate our device, if the dentist puts the miniaturized device inside the activator and press this button. 3 seconds. So the blue light means that we have started the activation, okay, of the technology. Now the dentist goes back to the patient, just screw it inside the implants, okay? And then the technology, our technology, works for 30 consecutive days, works in a radius of 2 millimeters around the implant, affecting both the soft tissue and the bone. Now, as you said, or as we discussed, we are the first company in the world that is taking this technology and bringing this into dentistry. So we had to explore, validate, and share with the dentist and the industry what are the benefits. So we've done for the past few years many clinical studies, animal studies, and in vitro studies. We published until today 9 articles. Most of them are in our website. I encourage you to visit our website. And what we have seen, and this relates really to your question, we have seen that we're able to pulse electromagnetic fields by reducing the inflammatory activity, increasing the blood vessels formation, and also increasing the mesenchymal stem cells differentiations to osteoblasts. It's able to do the following. One, we are able to reduce the osseointegration time by 3 times. So the treatment is over after 4 or 8 weeks instead of 3 to 6 months. We also saw, and this is crucial for those chronic patients with diabetes, heavy smokers, osteoporosis, and also that poor lady with cancer. We've seen through studies that pulse electromagnetic field is able to increase the bone to implant contact, bone mineral density, and also the number of the trabeculas that are covering the implants. And I think the most important thing, which is really a hot topic right now, Matthew, is peri-implantitis. And we have seen through a case clinical study that we have published, we've done that in Israel with Dr. Yaniv Meyer, and also in Brazil with Professor Jamil Shibli, that we're able to use our device for 30 days for patients with peri-implantitis and growing bone for them in inflammatory conditions. So it's really an adjunctive therapy with no surgery or adding bone grafting or anything. And this is the first time in, that there is any solution for patients with peri-implantitis. So that's what we have published until today, and we have many more things going on.
Wow, that's exciting stuff, I guess. So the reach so far in terms of number of dentists who have, maybe some approximation for how far this has reached in terms of dentists understanding a technology like this, the need for it, and that are beginning to utilize what you've made available. How far have we gotten?
Sure. So Magdent has CE clearance, which is the European FDA, and we sell this box. This is a bone growth accelerator device. This is the box of 10 units. Inside we have 10 of those. This is 1 unit of miniaturized electromagnetic field device. So we sell this in Europe, and this is the box, sorry, for the activator, which I showed you previously.
Okay.
So this is what we sell right now. Our distribution channels are through implant companies and large DSOs. So eventually, Magdent is helping implant companies with innovation. Our technology is currently compatible with up to 80% of the implants which are sold around the world today.
Okay.
And we are helping them by eventually distributing our technology directly through their distribution channels to their dentists. So for now, we have distributions in mostly Western Europe, which is Spain, France, Germany, soon in the UK, of course in Israel, but also we started recently in part of China, in Chile, soon gonna start in New Zealand, Australia, Hong Kong, and Singapore. And I really hope that we're starting soon the FDA clinical studies. And I truly believe that before the end of 2025, we're gonna be able to share with the US dentists. But now is really a good time, I think, from educational standpoint, to bring this technology into the US industry field. So we are working with a few key opinion leaders, Professor Jamil Shibli, Dr. Alberto Monge from Spain, and a few other names which I would be happy to share in a few weeks. But don't feel free to follow us on LinkedIn and other digital media channels, and I promise to share more about our technology.
That's great. That's great. I mean, it's exciting as far as the bone growth element as well to me. When I think about by the time people are getting implants, so much of the time they're they've had crowns and root canals and various things that have led right to chronic inflammatory or infectious situations. And that's as I understand anyway, part of the cavitation problem that's occurring and bone loss issues in general. So it sounds like you're saying not only as far as reducing kind of an inflammatory response, I guess, to the implant itself, right? Peri-implantitis, but also even to help resolve what's already been lost previous to the implant. Is that part of what you're saying? Is there hope? There's benefit and hope for people who have kind of chronic situations that rather than just how to make the implant itself go more easily. Is that right?
Yes, so you're on spot. So what we have seen is that for chronic patients with different problems, and this is really a big problem also for insurance companies, and we were able to show through clinical studies and also animal studies that we're able to actually achieve better results and reducing their failure risks for this specific population, and achieving higher results for the implant placement. But as we said, pulse electromagnetic field is also able to have a better treatment or control on the inflammation. So this is relevant for, and we all know that the implant stability is being the first 5 to 7 days are the most important days for the implant stability, which when the inflammation occurs. And pulse electromagnetic field is able to reduce the pro-inflammatory activity. Now, this is important for better implant stability, but this is also important for patients that suffered, and this is, for example, part of our upcoming R&D pipeline for peri-implant mucositis. We're going to start doing a study now and see the effect of pulse electromagnetic field on the treatment of peri-implant mucositis. And we're also exploring the effect of pulse electromagnetic field on bone growth, on bone grafting, which is based eventually on a successful series of case studies where we saw that by combining our device, our miniaturized electromagnetic field device, which worked for 30 days, but when we incorporate that with bone grafting, whether it's Straumann's, LifeNet, Geislich, or whatever, we get faster recovery and also better augmentation. So when you take, the anti-inflammatory activity, when you take building bone formation faster, and when you also take, and one other thing that we saw and we published, and we've done this another study with Professor Shibli and Dr. Magda Ferres from Harvard Dental School. We saw that pulse electromagnetic field is also able to affect the bacteria biofilm colonizations around the implants. So everything really brings us that this is going to be the new standard of care. Our target, Matthew, is to make a big change to get faster time to teeth, to treat patients with peri-implantitis, but hopefully in the future, we will be able to say that we're going to also be able to prevent peri-implant diseases. This is the direction where the company is really going.
That's awesome. I mean, there's no shortage of need, I'm certain, all over the planet, right? So
yeah,
so that's exciting. I mean, I love hearing about advancements and breakthroughs in areas like that. And it seems like since that technology was first in 1979 was developed, that it seems like, yes, it's time for dentistry to have access to benefits that were shown a long time ago.
So in our website, you're going to find our studies, but if you just gonna Google pulse electromagnetic field, you're going to find hundreds of articles about the benefits from orthopedic, and you're going to find a few which Magdent actually published most of those studies about pulse electromagnetic field and its combination with dentistry.
That's great. So in terms of just where things are going, more that you would like to share about future plans and maybe the R&D pipeline a little bit more? I know you referenced that, but what more can you tell us?
Sure. So really, we have two upcoming milestones. One is growth. So we want to bring this to the for patients, for more patients, more dentists, making this as the new standard of care. We're speaking with the leading dental implant companies, these days. I can't share everyone, do all the name droppings, but I promise that we're just speaking now. I'm in Italy for a conference, came back from Madrid a few weeks ago, and I was in the Academy of Osseointegration in Charlotte a few weeks ago before. We're growing, and we're going to make a huge change with, I would say, most of the implant companies make it really affordable for everyone. I would just mention that, and we haven't discussed that, but the price of adding our technology into the implant placement cost is less than 10% of the overall treatment. So this is really affordable, and the magnitude of that is really huge. So first one is growth. Second one is bringing this technology to the US. And third is our R&D pipeline. So Matthew, as I said before, we're now evaluating this technology with bone grafting in order to bring this innovation into this specific vertical, which haven't seen any tremendous innovation for the past many years. And also peri-implant mucositis, which occurs in 80 to 90% of the patients, unfortunately. And increasing the time to teeth for everyone. So part of the FDA that we're going to do additional studies to get proven results for this purpose. But every dentist, every patient that is interested, feel free to reach out to our website. I'm certain that you're going to share that with the audience, and follow us on the digital media, and everything is going to be available there.
That's great. Why don't you go ahead and just tell us? Yes, we can include that, but why don't you go ahead and just tell?
Sure. So it's www.magdentmed.com. So it's MAGDENTMED.com. Magdentmed.com.
Okay, that's great. And so if people also want to reach out to you, connect with you in any particular way, and there may be, even for different reasons, there may be people who are listening to us who are thinking, I don't know, can I get involved? How can is there a way I could participate? But also people certainly interested in the time to where they'll be able to access your technology.
Definitely. So first of all, website, you can leave your contacts or ask any question. Because Magdent is really, innovative, we always here for education to help dentists for first using our device, whether it's in the, in Europe, in Asia Pacific, or elsewhere in the world. But you can, reach out to us through info@magdentmed.com. Leave us any comment, any question, anything, and we'll promise to reply in less than 12 hours.
That's great. Well, obviously there was something about all of this, maybe the inspiration from your father being one of them, but also, I mean, you're an attorney. You've done a variety of things. That's kind of a big career shift, it seems like, right? So to me, that speaks to a passion that I hear within you about the value of this contribution. Is there anything more to say about kind of what's driving you in this? I always like to kind of get a feel for people and like why they're doing what they're doing. What stands out to you there?
I think that, I joined Magdent, let's say 2 years ago, and I really had a really, diverse career. And the thing is that I was involved on the background of my career because Professor Barak, my father, is one of the founders of Magdent, together with Dr. Moshe Neumann, which is a periodontist, done his master in the US in bone generation in Buffalo University. But I truly believe in this technology, and I truly believe of the value that we are bringing to the industry. I think that if it wasn't, what this technology is doing. And we're fortunate that we didn't have to invent anything. It's a proven technology. We just took a small wine refrigerator and miniaturized it into a healing abutment. And so my vision right now is making this, new change, new standard of care. And we were, fortunate to be able to make it really affordable for everyone, to bring equality for our patients, and to bring a better solution for chronic patients, and to, in the future, really to make a big change, peri-implantitis, peri-implantitis, bone grafting. There are a lot of things which are going on right now.
Well, personally, thank you for all the past experiences you've had that have led you to make these decisions, to move this forward, and help all the people that I'm absolutely trusting are going to be helped by your work, your father's work, and others, and through this technology. So, and I really appreciate the time that you spent sharing with us so that we can learn more, right, and know what to do. So I'm trusting there's going to be people watching who are absolutely excited about this and looking forward, and definitely want to encourage everyone to reach out and learn more, check out the website, and connect with you. So thank you for that. Any closing comment before I let you go?
No, nothing. I want to thank you very much for the opportunity, for having us and sharing our vision, our truth, and hopefully make a huge change in the implantology field.
That's great. That's great. Well, thank you, Benny. Appreciate it. So
Take care.
Everybody watching, this is the Truth Behind Dentistry podcast, and today we're kind of exploring and exposing some new additional truths in the world of implants and a great new technology. And so thank you for joining us. I've been with Benny Barak of Magdent, and look forward to seeing you on the next episode. Thank you.